In our unit this week, we're going to look at the subcutaneous mycoses. What you see, of course, in front of you is a foot that has an infection with a fungal agent, and a subcutaneous mycosis has occurred. Sometimes these lesions are described as cauliflower lesions based on their distinctive appearance. And of course, always important to be reminded of where this terminology comes from. Subcutaneous, beneath the skin. Other terms you may see that actually mean the same thing as subcutaneous. The hypodermis, literally below the skin, or the hypoderm. One manifestation of these subcutaneous fungal infections is termed chromoblastomycosis. This term translates color building fungal infection. Also sometimes referred to as chromomycosis, which is literally colored fungal infection. This results generally from a puncture or a deep scrape that has the infective organism on whatever it is that caused the wound. These infections have a worldwide distribution because the organisms are found in the soil worldwide, although there's more of them in higher numbers in tropical and subtropical regions, partly because fungi in general like areas that are habitually warm and moist. And that's combined with the fact that in general terms, areas of the world that are subtropical and tropical may have more people walking around without adequate footwear and covering for their lower limbs. There's a number of fungal species that cause chromoblastomycosis. We're going to just look at 4 or 5 of them here in this unit. If the infection is caught early, when the lesions are still small, the prognosis is good. Continuing on with chromoblastomycosis, or just chromomycosis. As I said, these are chronic fungal infections of the skin and the tissues beneath the skin. They take months to years to develop. So, of course, something that looks like this picture would have been ongoing probably for a year or two. The initial lesion may look like a ringworm, and that initial lesion might be a little itchy, but as this thing progresses, surprisingly, there's no pain associated with it. These are non-healing lesions. As I mentioned before, sometimes they're termed cauliflower lesions because of their appearance. Diagnostically, when the physician observes something that are called sclerotic bodies in a tissue specimen, the diagnosis is made. That physician at that point may not want to actually culture the organism to give it a name, because once he has the diagnosis, basically the treatment is going to be an antifungal agent, regardless of what the species of organism is that's causing this particular infection. If these things aren't treated and they progress, they do get bigger and bigger. They don't go any deeper into the bone, but over years, because of the chronic inflammation that's going on, they may convert to squamous cell carcinoma. These sclerotic bodies that are diagnostic are sometimes called medlar bodies. Chromoblastomycosis as a diagnosis requires the observation of sclerotic bodies. These sclerotic bodies, or medlar bodies, or sclerotic cells, are globe-shaped, cigar-colored, thick-walled structures, 4 to 12 microns in diameter. And these are seen in tissue sections from the patient, not seen upon culture in the lab. I'll change direction a little bit here and talk about the eumycotic mycotomas. We refer to these as eumycotic because they are caused by fungi. And you'll remember that fungi have eukaryotic cell structures, meaning they have organelles from a nucleus to a Golgi body, endoplasmic reticula, etc. The reason we have this distinction of eumycotic mycotomas is that there is another cause of mycetoma that for many years we didn't really know whether that particular organism was a fungus or a bacterium. It's called actinomyces. In more recent years, it has indeed been decided that it's a bacterium, and so we have actinomycotic mycotomas as well. But we're not going to study those in this unit because they're caused by a bacterium and not a fungus. A mycetoma, localized, slow-growing infection of the subcutaneous tissue. So far, sounds pretty much kind of like what we talked about previously. Causes swelling. Here's the distinctive feature here, drainage of granules through sinus tracts or openings in the skin. This one, again, differs from chromomycosis in that if it goes on for long enough, it may go into the bone and cause bone deformities. Again, more common in tropical or subtropical parts of the world. 4 organisms that we're going to look at briefly that cause eumycotic mycotomas include Pseudalericia boydii, Acromonium falciforme, Magirella mycotomatus, Exophiala genselmii. Now keep in mind that these same organisms can manifest typically in a mycetoma or in a chromoblastomycosis. So you have to differentiate names of organisms from the clinical manifestation that a given organism is causing. This is a mycetoma, and we can see that this is a knee. We see the drainage from the sinus tracts beneath the skin, and probably some permanent bone deformation is occurring or has occurred in this situation because of the length of time that this infection has been present. Acromonium falciforme is one of the species we're introducing. Here we have on the bottom left picture, this is a specific case report. It's a 47-year-old farmer, lives in Brazil, admitted to the hospital because of this skin lesion. The skin lesion has been progressing for a few months. Now, what is notable about this patient, besides the fact he's a farmer, so he's going to be outside working, is the fact that he's immunocompromised because he has received a transplanted kidney. So here you see a small lesion because he has sought medical care relatively soon, and a little sketch of what this organism would look like under the microscope. Pseudalericia boydii is the same organism as one with the name Pseudosporium apiospermum. Well, what gives here? Organisms should have one name, right? Well, we have to consider that historically, organisms were described and named based on their phenotypic characteristics, what they look like under the microscope, what the colonies look like when they are growing in culture, as well as some biochemical tests that were performed on them. So they were named based on phenotype. In today's world, of course, we can genotype organisms. And as the scientific community meticulously genotypes various organisms today, we find that sometimes there are things that were previously thought to be 2 different organisms are one and the same. And so that's why this is one of these examples I want to make you aware of, where one organism, 2 names. Well, it turns out that in the clinical lab, we rarely see sexual reproductive structures, and a fungus that reproduces asexually is called an anamorph. And that's what we saw in the clinical lab, and that's what we named Pseudalericia boydii. Well, there are times where the sexual stage of an organism can be observed, and in this case, they named the organism they were seeing Cedosporium apiospermium. You're probably not going to see Cedosporium apiospermium by that name in the clinical lab. Why? Because you're unlikely to see the sexual stage. So is it confusing? You betcha. Just want to make you aware that this type of thing exists. Want to make you aware that as we progress in science, names change. There are organisms that sometimes get moved from one genus to another based on their genotyping. Having worked in microbiology for a number of years, I can go back and think of an organism that had one name in the 70s. Maybe that one name got changed to another name and then another name. And by the time I left bench work in the 90s, maybe we're on the fourth name change for that same organism. So you really do kind of need a scorecard to keep up with some of these things as organisms are grouped and regrouped based on their genotype, their genotypic makeup. Here we're looking a little closer at the Pseudalericia boydii. Produces oval conidia singly at the tops of cells known as analides, hyaline hyphae that is septate, and filamentous. The colonies grow slowly, grayish brown, and then become grayish violet as they age. Continuing on with Pseudalericia boydii, I feel I've made this point multiple times, but it bears repeating again. As you're studying these, especially from a textbook as opposed to in person, I feel it's impossible to memorize the exact colony appearances, the exact microscopic appearances. So what you would spend your time on rather is what is distinctive about this organism. So in this case, you would key in on the fact that this species is the most common cause of mycetoma in the United States. That gives you a little bit of clue sometimes if you're working with a specimen. This infection produces yellow or white granules. Again, another distinguishing feature. As I mentioned, you are unlikely to see the sexual stage in the clinical lab. So the asexual stage, single or small clustered oval anneloconidia, just to, they've applied a specific term to the type of conidia, and those anneloconidia are on the end of annelophores. So lots of confusing terminology. Don't let yourself get too bogged down with it. If you were to recover Pseudalericia boydii clinically in the lab, these are the type structures that you would be seeing. Now we're looking at a clinical manifestation that is termed Madura foot. Madura, as a name, came because it was initially described and studied in a particular part of India known as Madura. Madura foot is most commonly caused by an organism named Mandurella mycetomatous. This is a dematiation or dark-colored septate fungi. And interestingly, even though it got an Indian name, it is more common in Central Africa. This is a deep tissue infection, so deeper than the chromomycosis that we looked at initially. Chronic, progressively destructive, discharging sinuses, and in this case, black granules are released. But similarly, it is still caused by tissue trauma, which introduces the fungus. The organism itself grows slowly in the lab, initially white, becomes brownish green as it ages. Does grow best at 37. And the interesting thing of these pictures is the one on the bottom center. This is one of those dark granules, and it has broken open, and what you see kind of spilling out of it are infective spores. So this is the way the organism would reproduce and keep stay alive in nature. Phaeohyphomycosis is a term that translates condition of fungi with dark hyphae. It's another general term for a clinical manifestation caused by a darkly pigmented or dematiaceous fungi. The dark pigment comes from melanin that's in the fungus. In tissue, this organism may form yeast-like cells that are solitary, short chains, or hyphae that are septate, branched or unbranched, and swollen. Nothing very distinctive there for you to spend a lot of time trying to memorize. What is important here is that there are no sclerotic bodies and no granules. Again, there's many species that can cause this manifestation, and again, they are soil organisms. This particular manifestation is historically rare, but in today's world, we have a number of immunocompromised individuals, and if an immunocompromised individual develops the infection, it is likely to become a disseminated disease. It is considered an emerging disease by CDC and World Health Organization, meaning the numbers are going up, and it's something that should be paid attention to as the numbers increase. The prognosis is poor in this situation. Of course, the prognosis is adversely affected by the fact that this person is immunocompromised. Exophiala species is one of the genera that is identified as a cause of phaeochromomycosis. These conidia are born on annealides, with conidia aggregating in masses at the tips of the conidiophore, and the conidia are at the tips of Phalaides. Exophiala gensalmii. What can it cause? It can cause the phaeohyphomycosis, mycetoma, probably even chromomycosis. Again, colony morphology, microscopic morphology is distinctive in a way, but in a way it's so much like many other organisms. If and when you practice in parts of the world where you're going to be dealing with this organism, you'll be hitting the textbooks, you'll be speaking with experienced mycologists that are hopefully working side by side and slowly amassing your own kind of encyclopedia of organisms in terms of what they look like and their distinctive characteristics. Sporothrix schinkii is the causative agent of a fungal infection that is nicknamed rose handler's disease, or sporotrichosis. This is another chronic fungal infection characterized by nodular and ulcerative lesions along the lymph channels that drain the primary site of inoculation, which is often the hand or the arm. The way this thing is going to progress will be dependent on the exact entry point, the size of the inoculum, host immune response. This is similar to all fungal infections. Again, this is a common soil organism, and as you might guess, the correlation with the common name rose handler's disease has to do with the fact that people who frequently handle roses, of course, are going to get poked with thorns, and in some cases the thorn may have this organism on it, and depending on the size of the inoculum and your current immune status and all of that, it might develop into sporotrichosis. Key thing to learn about Sporothrix schenkii is that he's dimorphic, meaning that at body temperature, it will manifest as cigar-shaped yeast cells, and so that cigar shape is a characteristic you want to hone in on. In the lab at room temperature, it will grow as a fungus. So here we have the same organism, Sporothrix schenkii. The yeast form, which we see at 37 degrees, the typical cigar-shaped or cigar forms. The fungal stage, which is seen when we grow the organism at room temperature. We'll see conidiophores with conidia, and a characteristic term to associate with this organism is daisy heads. And as you look at that picture, that's a nice clear picture giving you that daisy head appearance. A very important characteristic of this organism in terms of definitively identifying it in the lab, you have to be able to see both forms, the yeast and the mold form. And when you grow one, you have to be able to convert it to the other. And of course, how are you going to convert it? By incubating it at the alternate temperature. So here we have two tubes growing this organism. On the top, you see the fungal growth that was obtained by incubating at 25 degrees. On the bottom, you see what it looks like as a yeast, which was obtained by growing it at 37. This organism is fairly fastidious, and so as you're looking at it, the bottom tube, in any event, has been augmented with sheep blood in order to encourage him to grow. He is a rapid grower, and there you have the description of the colony and the yeast. Again, that's not what's most important for this organism. As you progress in your experience, you'll learn to get pretty good at identifying it if you see it. But for now, know that it's dimorphic. You have to convert from one form to another in order to definitively identify it. Those cigar-shaped yeast form and the daisy head fungal form. Phylophora varicosa causes, guess what, chromoblastomycosis or phaeohyphomycosis or mycetoma. The cauliflower lesions are characteristic. It's a soil inhabitant, nothing new here. These guys are all soil inhabitants that are widely distributed. But something that is typical of this organism is the ability to see black dots in the lesions. Here is the colony morphology as well as a microscopic morphology. An important thing to zero in on for this guy are these phyllodes that are shaped like a vase. It's kind of cute. And then this flared cup-like collarette. So they look like vases, and that's a key characteristic of this particular organism. So, time to go back and learn these guys. Highly recommend making your own chart and putting information on your chart that is most distinctive for each one. Go to the pronunciation website, practice pronouncing them. The pronunciation website may differ somewhat from my pronunciation, but you need to be to the point where you can come close to an accepted pronunciation, as well as being able to pronounce them without consistently stumbling. And it takes practice in order to kind of have these things roll off your tongue. Well, we made it. That was a lot. You can handle it. Systemic organization, or systematic, I should say, systematic organization of this material by making your own charts or your own flashcards or whatever, I think you'll find very helpful. Bye-bye.